Hello and welcome back. One of our followers have requested me to do a video on preeclampsia, and that is what we'll be discussing today. So, if you're new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels. You can also follow us in our social media platforms, that is RD Premier Hospital _Ngong, and then for our Instagram and Zawadi Premier Hospital Ngong for our Facebook page. You can also follow me at a personal level, that is Dr. Itsuma, and I will really appreciate that. So before we dive into today's topic, I want us to listen to some words of wisdom from the book of Psalms, chapter 84, verse 5. And the Bible says, "Blessed are those whose strength is in you, O Lord, in whose heart are the highway of Zion." And that is the word of the Lord. So let's dive into today's topic. So what is preeclampsia? So preeclampsia is a multisystemic condition or a disorder that affects almost all the systems in the body. Okay, but then it is evident by the presence of high blood pressure. Okay, so new onset of high blood pressure during pregnancy, and especially after 20 weeks of gestation. So anything below 20 weeks of gestation, probably that one was what we call chronic hypertension or pre-existing hypertension. You're already hypertensive, so it's not associated with pregnancy. But then if the high blood pressure starts during pregnancy, that is after 20 weeks of gestation, then it is associated with, or the pregnancy is the one that is alluded to be causing this high blood pressure. Okay, so the other thing that basically is associated with preeclampsia is presence of protein in urine. So under normal circumstances, you're not supposed to see any protein in urine, but when you see protein in urine, especially during pregnancy, it can only mean two things. Either you are having an infection or your kidneys have been destroyed as a result of preeclampsia. So when we look at a little bit of some statistics or some epidemiology, is that preeclampsia affects around 2 to 8% of all the pregnancies. So less than 10% of patients who get pregnant will be affected by preeclampsia. Number two is that the people who are at risk of developing preeclampsia, or what we call the risk factors. Number one are the people who are the first mothers. Okay, so if this is the first pregnancy, okay, so you are at an increased risk of developing preeclampsia. Number two are those people who are at advanced in age. So if you're getting pregnant, you are more than 35 years, research has shown that you have an increased risk of developing preeclampsia. And the other thing is family history. So if you have had a family history of preeclampsia, okay, you are also at increased risk. And then if you are obese during the time when you are getting pregnant, that's why it's good for you to be healthy and taking care of yourself before you get pregnant. So with obesity before pregnancy, you have an increased risk of developing preeclampsia. And then research has also shown that being black just increases your risk of developing preeclampsia. The other conditions that basically can increase your risk of developing preeclampsia include, number one, if you are carrying more than one baby, so multiple gestations, okay, because the presence is associated with the hormones that are produced by the placenta. So if you are carrying more than one baby, it means your placenta will be big, and if the placenta is big, it means you will produce a lot of these hormones, and these hormones are the ones responsible for probably development of the preeclampsia. There is another condition called molar pregnancy. Now, this molar pregnancy is associated with high levels of human chorionic gonadotrophin. Okay, when we were looking at a topic called hyperemesis gravidarum, I talked about molar pregnancy. Okay, so it's also associated with preeclampsia, and then Research has also shown that if you have many partners, okay, sexual partners, especially if you're getting pregnant with different partners, okay, you are at an increased risk of developing preeclampsia. And then the other thing is any other chronic diseases, like if you have already had chronic or what we call essential high blood pressure or essential hypertension, like hypertension before you got pregnant, you're at an increased risk. Or if you're having conditions such as diabetes, so if you're already diabetic, okay, or if you have had issues with the kidney, so you have some renal diseases, okay, either acute or chronic, or if you have had autoimmune diseases such as systemic lupus erythematosus, okay, or antiphospholipid syndrome, okay, you are at an increased risk of developing preeclampsia. Now, how do patients present? So, of course, when you come to the hospital, one of the things that we basically do is we take your blood pressure. So, with preeclampsia, the systolic blood pressure will be above 140 millimeters of mercury, and the diastolic pressure will be above 90 millimeters of mercury in 2 consecutive sittings. So, that are at least 4 hours apart. Okay. And of course, with the gestation, you're supposed to be 20 weeks gestation. So any onset of high blood pressure, 20 weeks of gestation, and then the blood pressure is more than 140 for systolic and more than 90 for diastolic. That one is an indication that you might be having preeclampsia. We also check your urine, okay, so with the urine, presence of proteinuria of more than 300 milligrams in 24-hour urine sample is diagnostic or is indicative of preeclampsia. So once we have diagnosed you with preeclampsia or you have been diagnosed with preeclampsia, the doctor will also order some few other tests, okay? Now, there is a condition that we have been talking about, especially in our previous videos of danger signs, okay? And this condition is called the HELP syndrome. Now, with preeclampsia, basically, it destroys your red blood cells. So your red blood cells keeps on bursting, and when they burst, it means then you will have a reduced amount of red blood cells, and that one can actually cause anemia. So you will have hemolysis, and then it also destroys the liver. So you will have elevated liver enzymes, and then it also destroys your platelets. So your platelet count will also go down. So it means you will not be able to clot your blood, especially when you start bleeding. Okay, yes. And then the other thing is with high blood pressure, there will be accumulation of fluid in your body. So the accumulation of fluid can basically happen on the hands and the legs, on the face, but it can also accumulate in the lungs, okay, and it basically causes what we call pulmonary edema. And with pulmonary edema, then patients will present with a difficulty in breathing. Now, with persistent high blood pressure, you can also expect these patients to come with headache, okay, or blurring of vision, or even seizures. So by far, those are some of the symptoms, signs and symptoms, of course. So with preeclampsia, there will be a lot of persistent headaches, okay, blurring of vision, sensitivity to light, okay, and then with the destruction of the liver, you will basically, the patients will present as well with epigastric pain, and then of course the swelling of the feet, the swelling of the hand, the swelling of the face, okay, and then with the destruction of the kidneys, you will end up with proteinuria, but also the amount of urine that will be produced will be very low, what we call reduced urine output. Now, with the accumulation of fluid in the lungs, patients will present with shortness of breath. So, when you do the test, basically, of course, when you check, the blood pressure will be high, and then when you do the urine test, it will be proteinuria, and then the edema will be visible, accumulation of fluid, and then also when you look at the liver enzymes will be elevated, okay? The hemoglobin level will be low, and then the platelet count will be high, will be low as well, okay? Yes, so those are some of the signs and symptoms that you are expecting in a patient who basically has complicated preeclampsia or uncontrolled preeclampsia. So we are going to look at the maternal and the fetal complications and basically how are we going to manage this condition. So number one is eclampsia. So eclampsia is basically the onset of convulsions in a patient who has preeclampsia. And then the other complication that you really want to avoid is what we call the HELP syndrome. We have already alluded to that. So the red blood cells are being destroyed, liver enzymes are elevated, and also the platelet count goes down. You also want to prevent stroke, okay, blurring of vision, persistent headache. You also want to prevent a condition called disseminated intravascular coagulopathy, which is basically a condition where the blood starts to clot in your veins, okay? So if it clots, it means then it's not able to move, and you basically, it's one of the fatal conditions that you really don't want to go into. You also want to prevent pulmonary edema, accumulation of fluid in the chest. You also want to prevent placental insufficiency, which basically can cause both fetal and maternal death. And then the fetal complications include, number one, intrauterine growth restriction. So the baby is not able to grow normally, okay? So you'll end up giving birth to a very small baby, okay? And then the other thing is preterm birth. So preeclampsia has been associated with preterm labor, which basically can lead to preterm birth, okay? You also, preeclampsia has also been associated with intrauterine fetal death. So basically, because of the insufficiency that takes place at the placental level, you can actually get that baby. The baby can actually die in the uterus. And then with the placental insufficiency as well, it can actually cause, it can lead to oligohydramnia. So basically, the amount of amniotic fluid you produce goes down significantly, and that can actually lead to the intrauterine growth restriction because the baby is not able to get enough space to be able to swim and to grow. And as well as the last complication you don't want is neonatal morbidity and prematurity. So by far, those are some of the complications that are associated with preeclampsia that you need to be aware about. So anytime when you come to the hospital, of course, medication very important, but also the definitive management for preeclampsia is delivery. So the baby needs to come out. Now, if there is a lot of complication, especially when HELP syndrome has set in, basically we need to deliver. So the baby will be given some drugs that basically can help to mature the lungs very fast so that you're able to help the baby, okay? But basically delivery is the end goal, okay, or it is the treatment, the sure treatment, okay? So for the rest, basically we are trying to prevent complications, but for cure, it is delivery of that baby. So if you present with any of those symptoms we have talked about, please don't wait at home because the complications that come with preeclampsia are dire and we really don't want to go there, okay? Go to the hospital, medications will be given. You will also be assessed. The baby will also be assessed, okay? So an ultrasound will be done to basically look at how the baby is and the fetal well-being, okay? So by far, those are some of the things that you need to be aware about preeclampsia. Now, if you are new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels, and I will really appreciate. Turn the notification bell so that you are able to be notified every time we post a new video. Until next time, God bless.